Yes, they are definitely affecting your mental health and your hormones because that is their job. So giving a hormone from outside, it is somewhere going to temper with your internal hormones also. It's not like your brain and ovaries are far apart so they don't talk to each other. Everything, ultimately the center is here and it's functioning here. Everything originates from here and that is what is giving signal to your whole body. Whenever we are consuming any amount of hormones from outside, they will go and they do changes. So they are doing their work. But along with them, they also do some kind of side effects. With many people, they are manageable, but a lot of people face issues ranging to both the levels. Some people say that they have improved mood after they take hormonal contraceptives, and many people that complain that they had a dysphoric, like a bad reaction to the medication, that I start becoming more hormonal, more moody, not able to control my emotions. So it could go either way. And then again, there is a set of population that says that I really did not mind taking them. I did not even feel I was on the pill. Many a times, if your depression or anxiety was not treated and the medication is given over and above that, so obviously that is not a treatment for anxiety and depression. But what will it happen? It somewhere is going to temper it. So you might feel relaxed with your anxiety and depression. But generally, people don't report such kind of things that whenever I started taking my hormonal contraceptives, I felt good. This is not something you and I have heard about, because why? If I don't have a problem, how will I report the improvement? Generally, we report a lot of dysphoria because that is very apparent and the person comes and tells you that I have become very moody. I am not able to control my emotions. I get angry easily. My partner says that I fight a lot these days. Do you think, doctor, this might be because of the medication that I'm on? And obviously, you don't directly give them the answer yes, because how can you be so sure that that is one thing that is the answer for all your queries? It might be a reason that might be helping you or might be troubling you or just exacerbating an underlying condition. But it is, until abhi tak in my experience, I have not seen that somebody was completely fine and just by hormonal contraceptives, they got this completely into depression and anxiety clinically. So it might have mood fluctuations, but not to the level of having a severe clinical depressive episode or a severe anxiety episode that you need to then take anti-anxiety or antidepressant medication after that. So something somewhere was underplaying, only then it would exacerbate it, but rarely to start something new out of the blue. If somebody feels that they are having any kind of complaint over these contraceptives, if it is transitory, if a woman, if she's absolutely necessary for her to take them at that duration of time and if she's not tolerating any of them, we sometimes try a very shorter course of duration of 3 to 6 months of antidepressants or anti-anxiety medications, consulting with the primary caregiver, primary doctor, that how would this help the condition. But generally it is not in such cases. Like if a woman is undergoing IVF, IUIs, or expecting to conceive in a few months and that is absolutely necessary for her, we try and add on some medication and gradually taper both of them away. So there are many ways we can do that. Synergistic, giving both of them together, tapering one down, adding another one, or stopping one completely, just shifting them to other medication. And sometimes even both the hormones are not required, so we take away one and just keep the patient on one hormone only. Very rarely, yes, you have to sometimes stop the medication if the person is not able to deal with them, and you have to come up with alternatives. And there are many non-hormonal contraceptives also, which you tend to generally shift the patient on if it goes unbearable. But in my personal experience, whatever patients I have seen, they had underlying other causes, n number of causes, socio-cultural, which could easily be, if they could be taken away, we would not have to have the patient stop their hormonal contraceptives. These same hormones, they are with us all our lives. So they will keep fluctuating here and there. But the more we talk about them, the more we normalize that it's okay, we are living with the hormones, but we don't have to live burdened with them. The more we know about them, the better we can cope, and the better we are equipped in today's technological era to live a better life. So nobody should suffer in silence. Like, even if one day, why to waste one day of your life living a pathetic life? So please, anybody who's seeing this video, if you just feel somewhere that I need help, do get help. Even if it's just a hunch that you're getting, that what if something is wrong, at least that doubt will be cleared out from your mind, that okay, this is something normal that I'm feeling and I really did not need help. So do not live in this kind of doubt. Seek help and see how your life can change for the better.